Hello, my name is Caden Forbes, and today I will be presenting on behalf of my team our cross-sectional analysis of artificial intelligence guidelines in journals of pediatrics, perinatology, and child health. Artificial intelligence is revolutionizing pediatric research by advancing data analysis, systematic reviews, and clinical practices. Despite its amazing potential, integration of this emerging technology raises concerns about transparency, ethical application, and reproducibility in general. This study aims to examine how prominent pediatric journals are navigating these opportunities and challenges through their author guidelines and policies. For our methods, we performed a cross-sectional analysis of the top 100 peer-reviewed pediatric journals as ranked by the SC Imago journal ranking. Information was collected from each journal's instructions for authors to assess AI-related policies, including guidelines for AI-specific reporting, authorship criteria, the use of AI in manuscript preparation, and image creation. Correlational analyses were used to examine the association between AI policies and journal characteristics, i.e. rank. Of the 100 journals that were analyzed, 87% referenced AI use in their author instructions, with most disallowing AI authorship. However, they required authors to disclose AI involvement in submissions. AI-generated content was permitted by 22% of journals, and 37% allowed generated images. Journals with higher impact factors were more likely to feature comprehensive AI policies, yet significant inconsistencies and a lack of standardized guidance in general remain. Turning our attention now to Table 1, what we can see here is AI authorship was not allowed by any journals, outright allowed. However, 15% of journals did not have a statement specifically allowing or disallowing the use of AI authorship. AI content generation and AI image generation were a bit more of a mixed bag. The majority of journals, 59%, did not allow AI use for content generation. However, 22% allowed it outright, and 19% did not have an adequate statement regarding it. AI image generation was interesting in that the majority of journals either allowed or did not have a statement regarding it, leaving a minority of journals at 44% with a statement disallowing its use. Moving now to Table 2, what we can see is out of the 100 journals, only 3% referenced an external AI guideline, i.e. Consort or Spirit AI, and that's in contrast to COPE and ICMJE, which are commonly referenced for general ethical considerations but do not have a specific AI component as referenced. In Figure 1, it's just some data visualization. What you can see is out of the 87% of journals that referenced AI use, only 3%, that small orange sliver, had external AI guidelines that were mentioned that are standardized. And 13% did not reference AI at all, which leaves a significant gap as AI technology is emerging in journal submissions. So, our conclusion was that although many pediatric journals acknowledge the impact of AI in research, few are promoting specific AI reporting guidelines, and that's hindering standardization and transparency in general, and making it difficult for people submitting journals in that lots of different journals have different non-standardized policies. So we advocate for the implementation of robust guidelines to uphold ethical practices, reproducibility, and high-quality research as we move into an era of AI-driven advancements. For acknowledgments, I'd like to thank my team and the Vassar research team as a whole. Their mentorship and resources provided have been instrumental in this project. And references, you can reach a link to a Google document with all of our references by scanning the QR code. And on behalf of my team, thank you so much for listening to this presentation, and go Pokes!